Welcome to Pharmative Live. My name is Dr. James Partyka. I'm your host for Pharmative Live. I'm a clinical pharmacist, oncology research scientist, and the founder of Pharmative.com. And I welcome you as we're streaming live from Palm Springs, California. Today we're going to be talking about coping and crushing COVID-19. Two kind of topics that kind of sort of go hand in hand together with each other. Pharmative is really about connecting patients to healthcare professionals and scientists in order to educate ourselves so that we can make informed decisions with our healthcare teams, our doctors, our nurses, our pharmacists, not only about decisions about your health, but your family's health and your loved ones. And that's Pharmative.com. And I wanted to show you something. And of course, I thought it was scored up and ready to go, but you know technology. Sometimes it just isn't. Oh, here it is. Okay, great. Okay, so I wanted to take 1 minute to talk to you about our PNN 1 Plus Health mobile app, because I believe it has a lot of useful and resourceful tools, including music and entertainment, but also including healthcare and health news. So I wanted you to know that you can go into your Apple and Android stores today and download our brand new version, PNN.1 Plus Health app. It'll say PNN.1, but this is what it will look like. And you can use it on your phone or on your tablet. It works very well wherever you have a cellular Wi-Fi connection. And as you can see, there's a number of tabs. And in order to play anything on the PNN.1 app, you just press the tab and that'll bring you into the tool. So the first thing I'm just going to press is dancing workout music. And you see we have a high beat dance and workout music. That is actually the #1 LGBTQ music station in the country. And I'm very proud of that. And I want to thank Alan and Corey for helping maintain the system, which is all digital, computerized, and on virtual servers and so forth. But then I wanted you to also know that we have an online magazine called Pride Nation Magazine. And a lot of the articles that I receive, I will reference on Pride Nation Magazine or summarize or put it in a blog, and you can find that information there. Now I'm going to just skip. There's all the social media accounts, so you can have your social media accounts, Instagram, Facebook, and Twitter. We have our own GPS chat wall, which is a lot about activities and events that are occurring in Palm Springs. We have PNN YouTube. So PNN stands for Pride Nation Network, and that has a lot of local programming and some nostalgic events from the past. And that's actually a very popular channel. We also have Ask Pharmative, which will bring you directly into Pharmative.com. And you can see all of our social media materials, which are locked down, and you can comment on those. Feel free to do all of that. But know that if it says Pharmative or Pharmative Care Team, that means it's material that has been reviewed and edited by our care team and myself and has been locked down so no one can change that information, and it's all confidential. So when you go into Pharmative, all you need is a username, password, valid email, confirm your email, and you're good to go. We don't ask for any money. We make our money through advertising dollars within the area and nationally as well. Pharmative Live, if you go into Pharmative Live, that'll have our library of videos that we have produced. So you can check that out as well. Then we have a workout station to do exercise with. We have Food Network TV. We have talk radio. We have a Palm Springs map. For those of you who are visiting Palm Springs, we have an electronic map here available to you. Another site of things to do in Palm Springs. A number of music stations that we've added along the way. One is called Pop MTV, which has all your favorite iconic videos like Madonna and many others, Lady Gaga, to reminisce to. We have another station, Musica 2021, Hip Hop Jazz, and I think what I'm going to do is also, this was a suggestion yesterday I received from someone, is add a classical music station as well. We have a meditation channel which can help you sleep at night. We have an Animal Kingdom channel, which is information all about animals and webcams of live animals and so forth. You can access Sky News Live here as well. Healthy TV from the Mayo Clinic. We also have retro sitcoms like Dick Van Dyke and The Lucy Show and Andy Griffith and a number of other sitcoms. We're also available on Roku. We're also available on Chromecast. And it's easier to actually access those programs from Roku or Chromecast, but you can also access them from here. So if you're sitting in an airport, you have nothing to do, watch some of the retro films that we have, TV, as well as cartoons. I like cartoons. Hopefully you like cartoons too. Now I'm going to get to the healthcare resource tools. We have a virtual pharmacy, so you can look up dosages, you can look up side effects of any medication. That's provided to you from the FDA. We have a channel called Disease Prevention. It's all about educating you on how best to prevent disease. We have another site from the National Cancer Institute, another site from the National Institute of Health with a great wealth of information, and we even have information provided by WHO, the World Health Organization. Now, a couple more that I want to talk about. I have a site called Dr. Symptom Checker. This is a chat bot that's produced by the UK. You enter your symptoms and it gives you a differential diagnosis. We have information provided by clinicaltrials.gov. So if you're interested in finding a clinical trial for yourself or a loved one, you can search. It's user-friendly. You can search very easily for that. And we have a site called Find Low-Cost Drugs. GoodRx produces that information for you, but you can find the lowest cost prescription drugs in your neighborhood, which is so important because I know dealing with insurance companies and some of the costs of these medicines are very difficult. And you can actually get some really good coupons that can lower the cost of your prescription medicine greatly. We have the weather, we have Google searches, we have events, and we have even games. So that is PNN.1 Plus. The plus stands for health, mobile app. Download it today. So far we have over 2,000 downloads and hundreds and hundreds and hundreds of active users on a daily basis with limited commercial interruptions. But I just think having access to this app not only provides entertainment, but also can improve your health care. So that's why I take the time to show it to everyone. Easy to use. All you have to do is get it on your phone or your iPad and you're good to go. Okay, so now, we always run a little long on. Now we're going to spend the next 10 or 15 minutes talking about coping and crushing COVID-19. And I realize for everyone, this is a very stressful, anxious time. People have other healthcare problems, and we're very focused on preventing COVID-19 and minimizing the spread of disease. But there are other health problems that are out there. And if you're working from home like myself, you may have children and pets and partners and wives and husbands and grandparents, and it can be very stressful to work in that kind of environment. And I also want to state that science of these vaccines, the 3 new vaccines that we have done, these companies, just stellar work of doing large randomized phase 3 trials. And the Johnson & Johnson will be coming out this week. And the Pfizer and Moderna came out at the end of last year. And so far, no new safety signals, which are being monitored closely. So I want the take-home message right now to be that all 3 vaccines are safe and efficacious. And that's what the FDA has determined, and the scientists behind all of this have determined. And you can't really compare one trial against another trial because they were done separately. So there's no head-to-head comparison of Pfizer versus Moderna. We don't have that data. And I don't anticipate that we would have that data soon. But with scientific data, it changes over time based upon new information, new knowledge, new studies, new laboratory experiments. So that's why the information may be changing a little bit over time, which makes you feel a little uncomfortable because it's kind of like, what is it, 45 or is it 47, and so forth and so forth. But I think the best thing for the audience right here, right now, is to think of these vaccines as equally safe and efficacious, all right? They were conducted, the Johnson & Johnson was conducted at a later time in different regions of the world, okay? So you wouldn't expect the numbers to be exactly equal. The Moderna and the Pfizer vaccine are messenger RNAs, and they're very similar because they're very similar technology, and they were conducted at about the same time, okay? There's not much of a difference between 95% versus 94%. Patient selection could explain that, just patient selection, the number of patients that you selected and the eligibility criteria. So it doesn't really matter to focus too much on those kinds of numbers. And again, there are no comparative trials comparing the 3 vaccines. What we do know is they're all 3 safe and efficacious to prevent COVID-19 disease. Now with the new one-shot Johnson & Johnson vaccine, it was determined to be 72% efficacious and 85% effective in preventing moderate to severe disease, which is what we want to do. We want to prevent moderate and severe disease. None of the patients were admitted to the hospital, and nobody died on the study. So it was a huge success, and it's done with technology with an adenovirus vector, which delivers the medicine into you. So it has a different pharmaceutical formulation of the vaccine than the other 2, Pfizer and Moderna. And again, you can talk about the numbers, but just remember, they're all 3 safe and efficacious. So when it's your turn to get the vaccine, you're going to get the vaccine that particular site is administering it. You're probably not going to have a choice, right? And it's not something to really worry about because all 3 of these vaccines work, and they work quite well. All right. Now, from a pharmacist standpoint, I want to remind you of a couple of things. You're not going to mix vaccines. So if you started with Moderna and you get the Moderna vaccine 4 weeks later, you're going to get the Moderna vaccine again. Okay, you're not going to go from Moderna to Pfizer. Okay, you're not going to go from Pfizer to Johnson & Johnson based upon the information that we have today. Okay, so you don't mix vaccines. Okay, so for the 2-shot vaccines, Moderna and Pfizer, you stay with Moderna. For both shots, you stay with Pfizer for both shots. Don't mix the vaccines. Okay, the other thing to keep in mind is you don't want to be immunized within 2 weeks prior to receiving the COVID-19 vaccine. And that's an immunologic reason and beyond the scope of this conversation we have today. So if your doctor is recommending you to get a shingles vaccine, and depending upon your age, you may want to make the decision, I'm gonna wait my turn for the COVID-19 vaccine first, because I feel like that's more life-threatening. Get the COVID-19 vaccine, and then down the road, get the shingles vaccine. So that's an interesting point as well, because there are many vaccines that are out there, and people are used to going, you know, to your pharmacy or a local clinic to get your flu vaccine and other kinds of vaccines. And again, you don't want to get them around the same time. And I would use that 2-week number as well. Okay. When you have questions about vaccines and medicine, go directly to the professionals. Go to your pharmacist, get to know your pharmacist, go to your nurses and doctors and your clinics and ask, okay? Because it is confusing. I have a hard time reading the names now or pronouncing the names of the new monoclonal antibodies. And I work in cancer research. So when in doubt, there's a lot of information out there. You want to go directly to the professionals. And there are hotlines out there for medical information questions as well. So again, go to the professionals. Don't listen to Uncle Bob, who may not even be in the healthcare profession. You know, go to your healthcare professionals. The information sometimes kind of sort of changes a little bit the more people you ask questions for. There's no need to do that. You have a question, go to the experts, which are your pharmacists, your doctors, and your nurses who know what they're talking about. All right, now, the last part of this is I want to talk to you about being proactive in getting your vaccine shot. And if you know of people who don't have an automobile or they don't know how to use the internet, it's a good neighborly thing to do for you, your neighbor, or your relatives to help them out. Because most of all of the scheduled appointments occur online and they're use different forms of software. That's a number one thing to do. The second thing is we want to help our neighbors. The second thing is we want to be proactive, and we want to be proactive by listening to our local health officials and our local news as to the risk categories and when you're eligible to receive a vaccine. You have to be proactive because things are changing very quickly, because the more vaccines we have, the more people will be able to get vaccinated. The Biden administration is doing a wonderful job with getting the vaccine supply out to the pharmacies, out to mobile trucks and rural areas and large vaccination centers and so forth. But you've got to be listening to the local news, and you can lean on a younger son or daughter or relative or neighbor or friend to help you understand where you fall in the risk category. Now, what determines the risk is based upon, number one, your age, the type of work that you do, maybe perhaps where you live, because maybe you live in a rural area where the vaccine has not been available yet, and comorbidities. So based on all of that, there are these risk categories that basically determine you are eligible to get your vaccine. Once you're eligible, you can schedule your appointment online or ask your son or daughter or grandson or granddaughter to schedule your appointment. Once you have an appointment, generally speaking, they'll schedule both appointments. They may schedule the first appointment. You go to the clinic or pharmacy to get your shot, and then they'll schedule the second appointment either 3 or 4 weeks later. If you get the Johnson & Johnson, you just get one shot. So that's good. And that's all I have to say today. There's so much information that's out there, and I know it's very overwhelming. But I always say to everyone out there during Pharmative Live is stay safe and healthy, as it's easier to prevent disease than to treat disease. And the vaccines have been developed to prevent moderate and severe disease, keeping you out of the hospital and preventing you from dying. So get vaccinated. I know a couple of friends in the area that have already started getting their vaccinations through CVS.com, CVS Pharmacy, and you're going to see more and more people getting their vaccines. And certainly the supply is increasing greatly. Now, in addition to getting vaccinated, we're going to still continue wearing our masks, practice social distancing, washing our hands, and this is all to prevent the spread of disease. So not everyone is vaccinated, and once you get vaccinated, you may feel like Superman or Superwoman, but the fact of the matter is the virus can linger in the nasal pharynx, and you don't want to pass that virus on to anyone else. So we're going to be wearing masks or double masks, practicing social distancing, washing our hands, and we're going to be doing that for quite a while until everybody gets vaccinated, and then we'll reassess the situation on where we are. And my best guess, and it's a guess, is that hopefully by the end of the year, Christmas time, things may start to return back to normal for us all. But the easiest thing you can do is to stay home and keep yourself busy and not go to large crowded events. That puts you at more risk. If I went to a large crowded event, I would double mask up, and I would certainly keep social distancing to minimize exposures, because I'm not vaccinated yet. And even if I were vaccinated, I'd still do the same thing at a large crowded event. So we all know that. I think we've learned a lot about the virus since a year ago, and we'll learn more as we continue to go forward. So stay healthy, as it's easier to prevent disease than to treat disease, and I'll see you next week. Have a good day.